I'm Dr. Rhett Polka, owner of 180 Physical Therapy. This is Dr. Haley Humphrey. She's here with us for the next year doing a residency from North Carolina. We are going to explain to you why, as a patient, you should choose to come to 180 Physical Therapy rather than any other conventional physical therapy clinic. One of the reasons why is because we're out-of-network providers with all insurance carriers. Here's why that is a huge bonus for you. We have true direct access, which means we don't have to wait for you to go see a physician to get a referral, and we don't have to wait for your insurance company to tell us how many times we can see you by getting an authorization before seeing you. So we work for you, not your insurance company. If you get hurt on Tuesday morning, we can see you on Tuesday afternoon. You're not waiting 2 weeks to get in for your first visit. And on that first visit, we're going to get to the root cause of your problem using our patented techniques and get you back to what you want to do, possibly after one visit, usually between 1 to 3 visits. Conventional physical therapy is going to wait 2 weeks to get you in because they're waiting for your insurance red tape to clear. Then they're going to have you scheduled 2 to 3 times a week for 4 to 6 to 8 weeks to get you back to what you want to do. So true direct access, true results on visit 1 is why we don't contract with your insurance company. And also don't forget, no billing errors. We're gonna charge you when you come in, you're going to pay, and you're walking out the door, done. You can also buy punch passes, which gets your fee for service down. And again, no billing errors. So we're not gonna contact you 6 months from now saying, hey, insurance didn't pay what they were supposed to, now you owe us more money. So now Haley's gonna talk to you about common questions about being out-of-network providers.
Yeah, so a lot of things people worry about is like, well, I'm just paying money up front, like my insurance is going to pay for it if I went through insurance. Well, out-of-network, you can still be reimbursed. So you can submit to your out-of-network benefits, get money back based on that as well. You can use your HSA account to pay for your sessions. So that's money that you're getting that can be going towards this anyways. Like he mentioned, we've got punch pass options, and by purchasing a punch pass, you're getting more sessions, a little bit of a discounted rate. And we also have payment plans for those punch passes. So you don't have to pay all of that up front. We have ways that we can work with you to make this work with your budget. Also, what we are currently doing, our treatments or times, everything we've been doing before with insurance, we're staying the same. Nothing is changing from the care that we are giving you, other than the fact that it's better for you and we can be working directly on what you need, not what insurance tells you that you need. And then also, if you have any questions, concerns, you're like, I'm skeptical about this, I don't know that it's gonna work, I don't wanna pay out of pocket, we offer free consults. It's a little bit of a shortened version of a session, but you get to feel hands-on what we are doing, see that it works before fully committing.
The other bonus is if you compare what you're paying for your in-network visits at a physical therapy clinic before you hit your deductible, it's not that much less than what we are charging per visit for punch passes that Haley was talking about. So conventional physical therapy clinics that take people who pay cash charge about double what we're charging. So if you think price is going to be an issue, let us show you the numbers and you'll see that you're going to be paying roughly the same thing that you would be paying if you get a punch pass for what you would be paying for your in-network deductible before you hit the deductible. And we're going to be seeing you for a fraction of the visits. So if we see you for 3 visits over 2 weeks, you're gonna be paying twice as much as that and going twice as long to conventional physical therapy if you're going 2 to 3 times a week for 4 to 6 weeks. So let us help you run numbers if that's what you're worried about. Now let's talk about Medicare patients. So Medicare patients, we are non-providing or non-participating with Medicare, which means we cannot give you a super bill, you can't bill Medicare. But once again, you are going to be coming in for healthcare prevention, which Medicare doesn't want to pay for. They want to wait until you have a problem before they will pay for physical therapy. We want to see you before you have a problem so you don't have a problem. So many of our Medicare patients schedule once a month, once every 6 weeks to come in for tune-ups, and we can work on fall prevention and doing exercises. And we also have group fitness classes that are free for 180 patients. So if you have Medicare, don't be scared away by the price, because once again, Your health should be the primary reason why you're picking a provider. We are the only ones that are going to give you preventative medicine so you don't have to come in multiple times a week, so you're not coming in multiple months in a row. You're coming in for tune-ups when you need tune-ups to stay ahead of the game so you can keep playing pickleball, keep going for walks, keep playing with your grandkids. All of those things are what we focus on because we're not doing sick care, we're helping you with health care. So if you have any questions, like Dr. Humphrey said, make sure you just give us a call, 970-593-9300. We can answer any of your questions. We can also schedule you for the free consultation that she was talking about. So if you haven't been in before, or if you've been in before and you're trying to get one of your friends or family members to come in, the easiest way to do it, rather than explaining what we're doing, because it's kind of hard to explain our techniques, just have your friend or family member call and schedule a free consultation, which, like Dr. Humphrey explained, is us running through a visit with them, letting them feel what we do and understand why we are doing what we are doing and why it's the opposite of everything you've tried in the past. So if you've got questions, make sure you call the number below. We'll look forward to seeing you. Have a great day.